Hello, welcome back. The topic today is the effects of aging on gallbladder. So probably you would have heard from any of your family members or even elderly people saying, nowadays I don't take non-veg. Nowadays I don't take any oily food like bhaji kind of thing and all. So you may think they have quit all those things, but most of the time it's all out of compulsion. So they are not able to eat or digest these things. So they say attribute it's all because of the aging. If you get older, your digestion will be like this. No. But most of though there are so many other reasons, but the main reason is gallbladder. Definitely there is aging has an impact on the normal gallbladder. So we all know gallbladder is a small bag, a pouch of bag which contracts stored bile into the small intestine for digestion. The normal time, normal quantity. So if it is not functioning, so the indigestion problem can happen. So what happens is mainly the purpose of the main bile is for digestion of oil, fat, fatty meal, fat. So as we get older, the contractile force of the gallbladder is reduced as a normal aging process. So when it cannot contract properly, so the bile will not come the adequate quantity at the right time. So naturally, the indigestion problem, gastritis, ulcer, these kind of things can happen. This is number one. Number two, the sensitivity of the gallbladder to cholecystokinin, a hormone which is very essential for emptying of the gallbladder. So if the gallbladder cannot empty or completely evacuate the bile, there is stasis. Stasis of the bile leads to thick bile and leading to infection and stone formation. And another thing is, as we get older, the cholesterol level in the bile increases significantly. So making the bile more thicker and more resilient for the emptying. So stasis, again infection and stone formation is very common. And over a period of years, as we get older, the gallbladder is functioning non-stop. So the muscles of the gallbladder, they go for some kind of fibrosis or repeated infection or something leads to the thickening of the muscles, which becomes ineffective. The gallbladder becomes very ineffective pumping the gallbladder bile. So stone formation is also more. So there is a big difference between getting gallstone in the young age and old people. So when old people get, the gallbladder is not functioning that properly, that is not contracting properly. Even there is a stone comes, it remains silent for almost for a period of time. It becomes more silent. The reason is the gallbladder is not functioning. See, if you're young, you're eating, you're doing other works, so the gallbladder has to function. Now, the contractile force or the function of the gallbladder itself is very less. So the complication also happening also becomes lesser and it remains silent for so many years. But it's very important, if a complication happens, a gallstone, cholecystitis, infection, jaundice, or the abscess kind of thing, or the stone travels down, then in old age the complication is very severe. It is almost 5 to 10 folds more compared to the younger generation. And another very important thing is, as the old people, sometimes they'll have a lot of other comorbid conditions, and the fitness for surgery, cardiac fitness, and all will be very less. So if you have to do surgery, then it becomes more difficult. Sometimes we cannot do anything more. So that doesn't mean, so as I get older, so I will remove the gallbladder as a prophylactic. There is no need for that, but we have to keep a watch on that. And most of the people, when we tell all these things, they will say, okay, then I want to know the function of the gallbladder. So what are the tests to be done? There is no need to do all those things if if it's all in the acceptable range. But if you want to know, then a simple ultrasound scan, CT scan, or preferably a radionuclide scan, HIDA scan, is more specific for the function of the gallbladder, that will show dyskinetic gallbladder. So this is very important. And suppose if any of your old family members or somebody says, no, I don't take because of the mage, give them a proper treatment. Probably they can also enjoy the meal. Thank you.